Typically, hip replacements for osteoarthritis are surgeries performed on patients in their 60s, 70s, or 80s. What do you do if you have significant arthritis that causes pain and limits your function, but you're in your 40s or early 50s? Are there risks to having the surgery at a younger age? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series where I answer questions that you or that other viewers leave in the comments to the videos on my channel. And just to be fair, all of these videos are not meant for medical advice. It's just for information and educational purposes only. So the question I got is, I have severe arthritis in my hip, but my orthopedic surgeon won't perform a hip replacement until I'm 55. Why can't I get it at a younger age? Well, first I'll say there's not a magical age at which it's okay to get it. And before that, it's not. After that, it is. Typically, yes, we've seen this in the 70s and 80s. We're starting to see that surgery creep down into people in their 60s and 50s, and yeah, sometimes in their 40s. And if you have very significant arthritis, especially in your 40s, early 50s, related to a traumatic injury in the past or some sort of degenerative or developmental condition of your hip when you were younger, there may not be all that much you can do. But the reason we typically say, all right, you want to wait as long as you can is those hip replacements have a life expectancy generally of about 15 years. Yes, there's data that says 20 and 25 years, but you can usually expect about 15. So let's just say you get that and you're 45. Well, you add another 15, you're going to be 60. That first hip replacement is a big surgery, but you can usually get over it. But revising it, taking out the metal and plastic and the bone that comes with it, that revision surgery is a monster operation. Ideally, you want to outlive that first hip replacement if ever possible. So the longer you wait until you do it, the more likely that is. Sometimes you can't and you just have to do it again, and there's not a magical age, but that's why we try to do it later and later so you don't end up needing a revision hip replacement. Now, if you have an injury, some kind of orthopedic injury, and you want to hear about options other than surgery, other than cortisone shots, you can click the link in the description below this video, fill out the contact form, and learn more about potentially scheduling an appointment to talk about your injury with me. I'd also love to hear about your experience with your injury, so you can leave those in the comments below this video. Just understand, if you leave a question in those comments, I can't offer you medical advice, but I might answer your question in a future video like I'm doing here. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.